afternoon, everyone, and welcome to today's Community Care Smart Assistive Technology webinar episode. I'm Anne Livingston and I will be chair and moderator for today's webinar. Today's webinar is about using virtual reality to create social change. This webinar is the 22nd webinar that we've produced in the series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. These webinars have been designed from feedback and requests that we have received through the collaborative. And our webinars are bringing together local, national and international perspectives in research and development, as well as focusing on the deployment of smart assistive technology in the sector. It's great again to have so many in the audience today, and I acknowledge that many of these attendees have attended all 22 webinars. I think we should run a poll and perhaps provide a prize to those if they reach their 30th webinar. Thanks again. Also, we've got our representation from every state and territory, and again we've got some international visitors on board. And I particularly acknowledge these attendees who are bridging time zones to participate. For those of you who have attended previous sessions, you'll know that we at Community Resourcing have been funded by the Queensland Government to bring together an online platform for community care service providers who are interested in collaborating on issues and practices related to smart assistive technology. We're very honoured to have been recognised in a few awards recently, and I particularly highlight the Advanced Queensland Innovation Agenda and the ITAC conference, where our project was awarded the ICT Innovative Entrepreneurial Award at the ITAC conference late last year. We're really pleased about the level of engagement that we're having in the project, and we're also seeing that we're having extensive national and international geographical reach, which you'll see in the following slide. During the time that the project's been running, we've been engaging extensively both on the site and in a face-to-face capacity. And really the focus has been promoting the use of smart assistive technology. But we've also been undertaking a range of regional activities with service providers and consumers. As this project has been taking off, we've also really seen an increase in the appetite for the uptake of technology. This has been both by service providers but also, most importantly, by consumers. And we're really pleased that the Department and the Minister has announced that she's provided some funding for us to develop the site further to include a consumer portal. This is in production right now, as well as various and pretty extensive enhancements to the site that are being undertaken from the feedback that you as participants have provided to the site. I need to start today's session with our usual disclaimer that neither Community Resourcing or the Department of Communities, Child Safety and Disability Services are promoting or endorsing any particular product, research entity or organisation. Rather, our webinars are designed to inform viewers of examples of various smart assistive technologies in development or in deployment. We're really pleased in today's session that we're going to have a fellow Queensland Community Digital Champion to present on her project, and this is a particular focus on how workforce options are being explored with special needs groups, and particularly also those living in rural and remote locations. In today's presentation, Julianne Lambourne is going to take us through her project that is looking at using immersive, or that is currently using immersive technologies to create great options for people who are looking to participate fully in the workforce. I remind people who are in attendance at today's session that we are recording today's session. So in the interest of that recording, we've muted your microphones. If you have any questions, though, we really encourage that dialogue and the interaction within these sessions. There's an opportunity to post these on the question pane on the right of your dashboard. Please post early. We will review in the background those questions and have them ready for the end of Julianne's presentation to ask her those questions. If we can't get to everyone's questions by the end of the session, we'll certainly follow up with both Julianne and the questioner with any follow-up. But it's my pleasure today to introduce Julianne Lambourne. Julianne is the Chief Executive Officer for enVizion Group Incorporated, an Indigenous owned and operated business located in Cairns. This business specialises in the delivery of development programs, and Julianne will take you through an overview of this organisation in her presentation. Julianne's experience is really extensive in community care settings. She's worked in community development, social engagement, mental health, and in management. And she's used all these experiences to be translated into the development of programs within a framework of community and individual capacity building. Julianne is a founding member of enVizion and is motivated by her commitment to delivering better and more creative programs that have a real emphasis on propelling people into a future that allows the individual to identify and commit to. You'll see through today's presentation, Julianne is passionate about the development of Indigenous businesses and leaders, and particularly has a focus on working with disadvantaged groups. Julianne has various training and qualifications and is currently completing a Master's in Business Administration. Welcome, Julianne, to today's session. And I'm going to hand over the screen to you. Thank you, Julianne.
Thank you, Anne, and thank you for everyone for linking in to hear my webinar today on what enVizion does. enVizion is about supporting all Australians. We are an Indigenous organisation, but what we realise is everybody has a need out there. We provide specialised programs for First Australians, but if you would have seen in the photo before, we work across the board with many groups that come into a disadvantaged criteria. And we try to help them by producing different type of program opportunities for them to engage in areas of their life, with their family, within the community, and also within the workforce. Now, enVizion was established in 2013, and we have been going since then. We have a unique group of people that work for us. Our brings together our unique service offerings. We really try to create programs that are extremely holistic, so that we're dealing with every aspect of the person. So the person, we try to break down the areas of multi-agency support and try to help the person, you know, deal with all of their issues with not as having to go everywhere for different types of services. So we've, you know, in our short period of existence, we've helped probably, or would be almost 500 people in 3.5 years in different areas around social training, employment, and being more productive in their community, and also business development as well. So enVizion, we work on quite a large range of different programs. One of our newer programs, which was launched in January, on the 31st of January, was a virtual reality experience project. Now, I was introduced to technology about 2.5 years ago through a conversation, and then went and experienced virtual reality firsthand. And my first thought was, my gosh, imagine what we could do with this technology in assisting people. You know, and there's all, I'm an ex-trainer, worked in education for years, and, you know, we work in a classroom and things like that, but to be able to immerse people 360 degrees is a different playing field altogether. You know, people can experiential learning themselves through their own emotion. You know, they can actually feel like they're with that person. They can actually see firsthand what it could look like in that environment. And that's why we pulled together this virtual reality experience project. And we looked at what we were doing in the clientele that we were dealing with. And, you know, we look at how do we bring about working with them towards parity, and how do we create employment opportunities for them to become self-sufficient in their finances. So that's why we focused our first virtual reality experience in this. 5 employment themes. It's really like a tool of career operations. It's completely immersive, so 360 degrees, and we actually use live people and film them in a green room, so that, and they're called virtual guides. So people are experiencing a real story, how a person got to where they are, how they had to overcome the experiences that they did. And instead of, we chose this because we wanted it for people to hear a real story. And it was a story of overcoming as well. What did they have to overcome, you know, to get to where they are or where they've been for a long time? You know, what do they have to sacrifice in there as to be employed, you know? Some people have disabilities, some people don't have disabilities, but they're all from a very diverse range of backgrounds. Now, our themes that we decided, and the reason why we chose these themes is because there is such a range of opportunities within those positions. You know, they're not a sort of one size fits all. There are many, many opportunities. So we chose agriculture, and we highlighted the banana farm in Hopevale. We chose construction. We chose health. Aquaponics isn't actually about employment. Aquaponics is about community development. And aquaponics is about a mixture of aquaculture and horticulture, which I believe is it's going to be a new way of producing fresh produce, because in my belief, being an Indigenous person and living in Cairns, everyone should have the right to fresh produce. Now, if you live in remote or rural, sometimes this isn't an opportunity, it's too expensive. So this is a system that people can integrate either in their backyard, from a community level, and it also has business development opportunities as well. So actually the next slide is I wanted to bring to life who the virtual guides were, so people could actually see what they look like, whether they are real people. So I'm just going to show you a little clip of who they are. Our virtual guides, we put the word out to find 5 people from these areas. And to have a range of opportunities. So Rachel is our mining guide. Ray actually works on the Hopevale banana farm, and he has been there for many years. Mario Marbo actually owns his own construction company in Rockhampton. Guju Guju is a traditional owner from Cairns, and he works across his own business called Agriculture, and also for his traditional owner group. Jason is a doctor from Western Australia, but within the health guide we also have 2 allied health workers as well. So as you can see, they are real people. They have real stories, and their stories were really about overcoming. For example, you know, if you have an opportunity to look through the VR, Ray, who is our agriculture guide, he actually comes from a very diverse background where he was an alcoholic living in a park, who got his life together and is now working on the banana farm. Guju Guju actually had a stroke and died, but of course brought back to life, and he now has disability from the stroke, but still is productive in his business and also within his traditional owner group as well. Rachel is a young woman who drives one of the biggest excavators in the world, and she talks a lot about having to leave family, you know, the long hours that are required. But she also talks about the benefits of working in mining, and the benefits are being able to help her family. She didn't always start as an excavator driver. She actually started in admin and worked her way through. Now, Jason's story is not actually about being a doctor. It's about seeing the health within his communities and what he could do to help with the health. So that's why he became a doctor as well. So the user categories that we have, people have asked us whether it actually fits into a criteria or does it fit into an age group. We've actually had people been in the VR from primary school right up to 85 years old, and they've all absolutely loved the opportunity with the VR and what it could create. So at the moment, a lot of the user groups have been in schools, primary, which is about planting the seed. Secondary is really good for Year 10 when they're putting together their set plans, and Year 12 students who don't actually have a bit of an idea of what they might want to do with their future. We've been up to rehabilitation centres where people are about 3/4 through their rehab programs, and now they're looking at exiting out what opportunities are out there for them. The Flexible Learning Centre for students who are not participating in normal school, so they have a lot of behavioural issues. So it's been fantastic, the outcomes for those students using VR technology to look at opportunity has been amazing. Job active providers, they're the ones that help people, you know, their role is to get people into work. Disability services as well, we've had quite a few groups come through like that. People with mental health have come through the program, and it gives them an opportunity to have a look at what they could possibly do. Different community groups, so we've had, you know, women's groups, men's groups, elders groups go through as well. And people say, why do you put elders groups through? Because, you know, it's about getting them interested in technology, but also about them implanting the seed that they can share with their families as well in the groups that they actually are working with. Now the bus, we've actually built a purpose-built bus to carry the virtual reality, as you can see in the photos. The reason we did that is because one reason is we wanted the bus to be able to travel everywhere and not be held back by location, whether it's remote or rural. Now the bus is, we call it a bus, but it doesn't transport people. It actually pulls up in a location and people enter the bus. And then sit within the bus. It's fully transportable. It actually runs off its own generators, so we don't have to rely on people in regards to power or anything like that. It's staffed by 2 staff, which is a husband and wife team. And the reason that we have those 2 people in the position is she has, the wife, Pauline, has experience of 15 years in employment and training operations manager, and her husband is a very long-term alcohol and drug counsellor. He's also a nurse and a teacher. So the combination of those 2 experiences travelling around, because it's not just about putting people through the VR experience, it's actually a whole project. So once people experience the virtual reality, they come out, and then we have a conversation with them about the areas that interested them the most and how can we help pathway those people to get down that area. Now, if people are struggling with addiction issues, Peter's experience as a counsellor then comes in to talk about the things they may have to look at implementing to overcome those barriers. We then work with the providers as well on how do we assist them in helping those people reach their goal or the areas of interest as well. So in the bus it actually seats 8 people. If people can't actually hop into the bus, they actually can be sat outside of the bus and still experience the virtual reality outside of the bus as well. So that's the glory of having a transportable vehicle that can go to any location at all. Now just a little bit on the technology side of things. We chose Samsung Gear VR, and it's powered by the Samsung Galaxy S6 phone. The reason we chose Samsung Gear is simply because it's transportable. We don't need to worry about laptops or cords or things like that. The phone actually just presses in front of the Samsung goggles and is actually visually stimulated. So once you put on the Samsung Gear and the phone is in, it'll actually pick up your eye sensory and it'll turn itself on. Now, within the bus, the speciality of the bus as well, it has a certain type of server that's in the bus. Now, if we don't have mobile network technology, that's okay. It still hooks in and everything gets reported out later. But what happens is once the bus has people in, they're in the VR and it's all stimulated, it enters into the server. Now what happens is the server then comes up onto a screen. Now at any given time we can actually tell how a person is engaged with the storyteller, the virtual guide, and it comes up with a colour system and a percentage system. So what that means is if someone is in construction and they might be more interested in watching a house being built around them rather than what the storyteller is telling them about that position. Now the reason we've done that for is it's all about data as well and how engaged the people are. Now when people come out they could say, hey, I was really interested in health, but the user focus report actually tells us they were more interested in mining. So then we can actually start to draw that information out what it was, because they could have been really interested in the trucks or the excavator that they're looking at. But when you start to talk about, but your user focus report says you were really interested in health, then they can talk about, they start to talk about, yeah, this is what I felt the story was telling me. For instance, a lady who was in rehab was just about ready to finish her program. She had come out of the VR and actually said, now I understand why I'm meant to be a nurse, why I'm meant to work in the field of health, because she heard the story about why the doctor wanted to help people. And, and that gave her a really insight into what health was about and why she should be involved in health. So that's a really important thing about what the bus is set up for, and it's those user focus reports. The schools really love them because they can actually use that data in helping the Year 10 students develop their set plan, and they can really draw out the information on why they're interested in those areas, then start to put together their student selection, the subject selection from there. And what our staff does with that as well is then look, so when they find out what are the areas of interest from those user focus reports, and then from the conversations with the people, they can actually start to give them the information to actually start to pathway them along. So the outcomes to date have been, we've actually had probably, or if not over, would be up to 1,000 people since the bus has hit the road late February already, going through the bus. So it's actually very busy and lots of different through. What we've found, now you may remember I talked about the Flexible Learning Centre. Now the students are there, their behaviour is really heightened. Their behaviour is not the best. That's why they're not in normal school. What we found is there were different areas of those students. I'll give you an example. There was one particular class who they didn't bring into the VR, and when my staff had actually said, oh, what about that group? They said, oh no, you don't want them in your bus. They'll destroy your bus. And they'd been watching them all day and their behaviour wasn't very nice. But they, Pauline and Peter actually said, no, let's get them in the bus. So they got them in the bus and they were really ratty and, jumping around. But then they put them in the VR. Now those kids didn't move for 25 minutes, so much so a quarter of the way through the teacher took off her VR headset because she thought all the students took off. She thought they ran away. And then she kept her headset off and she said that in all of her years of teaching students with behaviour management issues, she had never ever seen that before. For a full 25 minutes where they didn't move. They were completely immersed in what they were watching. Now when they came out of the VR, and this is really important, then Peter and Pauline were actually able to engage with them in a conversation about what they saw. Why did it interest in them? Well, what were the areas of interest? And these are the kids that you couldn't even get a sentence out of most of the time because they were either teasing each other or bashing each other. But they actually were engaged, and you could actually say to them, they said, oh, I like that construction. Oh, I could probably build a house. So it really started to change an area in their thought processes for them. The other areas, when I say clearer career direction, like a lot of people that have gone through have been really unsure about what they've done. They may have been interested in areas and they've actually gone into the VR and they've come out on the other side, like the lady from the rehab centre or another people. We've actually had comments of people in remote communities. Some communities have said, we didn't know women could work in mining. we didn't think women, they could, or, and they said, oh, we would have applied for that mining job if we knew we could have. So it's about showing them that the opportunities are out there. The other thing as well is in remote location, rural and the remote, they don't have like technology. We have Indigenous knowledge centres, we have libraries, but we don't have a great deal of advanced technology. So it's about introducing them to advanced technology opportunities, and also about showing them what is out there as well in regards to technology, just to draw their interest out. And we get a lot of fear, of course, of people. They don't want to hop in this thing. We find the best way to explain it is, it's actually your own movie. You're watching your own movie, just you, yourself, and the actors in there, and that's what gets them in. And it's also about what comes out of that is they start to have their own ideas. Well, how about we develop this, or I've got this idea, we could do it in this technology. So it's kind of opening their minds up towards technology, and it's warming them towards technology and how they can look at developing things for the future. The other thing is, it's about people knowing that regardless of your situation, we can help you. Assistance is out there to help overcome what their experience is. Whatever the challenges are, we can help overcome that. We can put them in contact with people who also can help overcome that. And that's why we've chosen a lot of the stories. Like I was saying, the ex-park alcoholic. He had to overcome so much. So he actually says, and the construction guy, he talks about being a young person who was a hard head, which means, a bit naughty, doing silly stuff. So he got sent back, and he had to listen to his elders. So he talks about listening to people, learning from your elders, and overcoming that to get where you are today. And it's also about encouraging, they're very encouraging that if I can do it, you can do it as well. And a part of our other role is to help progress those people towards those goals. So it's not just about them having a wonderful viewing for 20 minutes. Well, how do we help those people move towards other areas? So it's it's an interesting way of engaging people. It's a different way of engaging people as well. We're finding some incredible outcomes from it already. We're starting to work towards getting the data, so we want to do a lot of follow-up work to see actually what the benefits are, how people are, whether they're still engaged. We have lots of conversations, and we're still finding that people who have gone through the VR are still engaging in those conversations about moving forward. We have conversations from people in remote community about when can we come back, because they know that it's an opportunity for the young people who are really lost in remote community, who don't have a great deal of things to look forward to. So they're wanting us to come back and actually put the young people through and give them some direction as well in their lives. So we're seeing a lot of different outcomes. Now the VR bus and the VR is not just Queensland based. It's wherever the bus goes. So wherever we're asked to come, the bus goes to. So at the moment the bus has just come back from the Cape and is just heading over to the Northern Territory as we speak now. So and that's what it's about. It's about being transportable. It's about getting everywhere to the people who wouldn't have the opportunity. Even people in a larger regional city, we take for granted that we have so much stuff, but there's still a lot of people out there who don't have that opportunity. So it's getting it to those people as well. So we've had all different types of groups. People ask, because it is Indigenous, and that's why I have this photo up here, but we've had all types of people actually go through the VR bus, whether they're from non-English speaking background, non-Indigenous, other countries. Now what we find is when people go through, they don't actually see the colour of a person or their descent or anything. What they see is a person talking about overcoming their issues and what it's like in that employment area. So the reach has been incredible, and a lot of the feedback that comes through from all different types of people is the excitement of it. Oh, I could do that. Oh, I know that I could do that job. Or how do I do that? What do I have to train? What do I have to do to actually get that job? So, and that's been the exciting part of it, is the reach that it has and the excitement of all those people putting through from every different nationality, and all of them share the experience of it all. So But it's one of quite a few projects that enVizion is looking at the moment, because I really believe that technology, as a lot of people do, is going to have such a huge impact on the future. You know, we're working as well with people with mental health using multimedia programs at the moment, and they're producing a lot of things through iPads and cameras. You know, whether they're doing a book production about their story. We found that using that type of technology as well has been really effective with the people with mental health. It's been a real healing process for them, because they've been able to talk about their stories, and by talking about their stories and then putting their stories in a written format has really helped them heal their grief from the past. We're looking at introducing technology to a range of people as well, and creating documentaries, and they will become the film crew of the documentary. We're looking at running multimedia programs with disengaged youth who are in the youth justice system, and that would be getting them to be the film crew as well, to produce documentaries of their lives about how they are. And we use this, and the reason we use technology is, one, because it's engaging. Two, it creates a thought process that they have an opportunity to learn. And three, it gives them a really holistic way to learn. You know, we do the classroom stuff, we do the workbook stuff, but when you introduce technology into learning, it completely expands their mind into what the opportunities are for them, and it actually even expands their mind in their learning capacity. Because a lot of people really think they don't have a large learning capacity, but if you introduce them to technology and they participate, all of a sudden their learning capacity expands, and then they want to know more and they want to learn more. So, you know, it's an amazing place to be in. It's an exciting place for enVizion to be at, and, you know, we're really excited about the future. So that's my presentation for today. Thank you for listening, and I'll hand it back to you, Anne.
Thanks very much, Julianne. Great presentation. Superb insights into what you're doing up in CADS, but what you're delivering nationally. Thank you very much. While you've been speaking, we've got a number of questions that have come through, but I just encourage people who want to ask some questions to put them on the question pane. I'll also just note that there's a question from Desley that seems to need to be reframed, so I'll just ask Desley if she'd like to send that one through again. But firstly, Julianne, I've got a question from Charlie. Charlie's a rural and remote community care provider, and he wants to comment to you that he thought it was a really great presentation. It's opened his eyes to how new technologies and emerging technologies can really form some of the things that he's doing in his local service delivery. But he also asks, is there some challenges particularly that you might, or barriers that you might comment on if you're getting started at doing something similar?
I guess the challenges is knowing what the challenges we found in the development of our product, because we'd never done anything with technology for one, is ensuring that you know exactly what will have a really good idea of what product that you're wanting to, what is your end goal, I guess. What do you want the product to look like at the end? Because we weren't a bit sure of that, so it made that a little bit difficult coming through the process. So when we're developing now other technologies, we make sure that we know what it is we're looking for at the end of it. From there, we can build on from that. Also understanding if you're wanting it to be immersive or using live people, ensuring that you have the right people involved to develop the technology, and that your message is getting across about what you're wanting. That's the development side of it. Ensuring also that you do your research on technology developers, and making sure that that's a fit as well. That's really important, as well as a technology developer, so that you know that you're going to get the quality product at the end. Around the people, you know, quite a lot to find the right people. So we had a lot of pre-interviews with people. We did a lot of pre-filming with people just to see how they would go on screen, you know, what their stories were, and you know, because you're filming someone for hours and you've got to fit that whole story into 5 minutes. So it's about having the right type of messages come through. It's scripting the right script, you know, it's all those things as well to take into consideration. So those were the learning barriers for us as well. But making sure, just for us, it was just making sure we knew what the end goal was. You know, it doesn't mean it doesn't give you the flexibility to change or to do things, just to make sure that you know exactly what you want at the end. So I hope that answers that question.
Yeah, thanks, Julianne. That's great. I've got a question from Liz in the Gold Coast, and hers is a practical one, I guess, about cost of the equipment. And also she goes on to ask, you know, are there big burdens around maintenance and repair of the equipment, and anything about that you might want to comment on about when the equipment's used by multiple people?
The uptake, so the build, a build in that format was very expensive. It actually was federally funded. Because it had actually, because we use live people, but then we simulated the environment. So with the mining one, you've got trucks driving around, you've got excavators, all of those things. So that was all built. So that can be quite an expensive exercise doing it that way. The equipment itself is not expensive, like the Samsung Gear headset and the phones. You could probably buy that, you know, for about $800 now, $900. What we do is to make sure, so the technology people, as part of their contract, is they give post-service. So if we're having any issues, they just are able to link into the server to fix any problems up really quickly. We find we don't have we had a few little teething problems at the start, but now everything runs quite smoothly. But knowing that you have, that's why it's really important to find the right technology developer in order for that post support, which is really important. So we find any issues they can fix pretty well immediately or pretty soon after. Hygiene is really important because it's going through so many people. So we have really strict hygiene practices involved. After every use, they get wiped down with disinfectant wipes, you know, to make sure that, you know, we're not passing anything on as well. So, and plus with the gear, the goggles, we actually have like a little interior cover. So they're not actually having the gear specifically on their face. There's a little cover between the skin and the phone, the gear. So that just protects that as well. And they're easily wiped down as well. But, you know, as in regards to upkeep, there really isn't, we haven't had any real problems at all with the phones. The only thing with Samsung phones is they can tend to overheat if the bus is hot or you're in an environment that it's hot. So you make sure if you're using Samsung gear and phones that it is a very cool environment. And we know how long we can use the phones, because we can be commissioned out for a day to run a whole heap of people through. So we know we can run it up to a certain period, then we shut for about half an hour, have a lunch break, and that gives a chance for the phones to get recharged again to be used for the afternoon. So it's just making sure you have all those things in place as well in order to make sure you're protecting everything. So
that's great feedback. Thank you, Julianne. A lovely comment on our question pane here from Leonie. I think it's Leonie who's a frequent flyer on our webinars, and she's, if it is that Leonie, she is in a national role, so I'm not quite sure in location, Julianne. But a lovely comment from Leonie that your presentation inspires me and others to use technology to change lives. Thank you for your presentation today.
Thank you.
And I've got another question from Christopher. Christopher comments that you mentioned you've got 1,000 people to date going through the site, and that's really, he congratulates you on how large a number of people have utilised it. But he's wondering, do you publish where the locations you're going to in advance?
We generally do. So we use social media a lot. So what happens is the bus, so because it's a charged out bus, but we keep the fee really low for people to use. So organisations will bring us in, or schools will bring us in, for example. So what we do is we use social media. So we have a Facebook page. We generally send out the marketing material, and a lot of organisations will put that up who have taken the bus out just to advise people of where they're going. We probably should. We're going to develop what's called a tracking system soon. So if people are interested in our Facebook page or our website, they can actually track where the bus is going in advance. So we kind of really rely on that, I guess, a lot. We really rely hard on social media to get the word out of when we're coming through a community. And in a lot of cases that has been quite effective, because people will, if they're on Facebook, of course, and they're aware of we're coming through, people will be waiting for the bus to arrive, because you can't miss it. It's such a large bus coming through. You know, but we're always open to people's suggestions on how to make people more aware of what it is about and how to get it into their communities. So, yeah.
Terrific. And we hope through the collaborative that we'll have more people perhaps coming to you and asking you, you know, where you're going, and also asking you if you can come to their particular communities. Now, I've got another question here, which we're just trying to bring up. I think it's from Rachel. Rachel asks, a great presentation. Is there anything with VR which can assist in learning living skill tasks, role modelling train stations, public transport, etc., and paying your own groceries? I guess, Julianne, both you and I know through the Queensland Community Digital Champions program that Stuart Koplik and Chris Beaumont are also Queensland Digital Champions. And Rachel, they're doing a project that is using VR, modelling train stations, cafes, and some really practical living environments for their clients at Endeavour. We did hold a webinar earlier in the year on their project, alongside another project that was looking at using VR for informal carers, and that webinar also highlighted the virtual reality for dementia project in Victoria that's recently been awarded the Microsoft World Citizen Award. So I'd encourage you to have a look at that webinar, and you can find that posted on our collaborative site. But Julianne, over to you. Do you know other examples of VR being used to immerse everyday situations?
Not so much around the life skill. I do have some awareness of some projects around community development, cultural heritage mapping. But, you know, I have seen a couple of technology developers who are moving. They have some product out there that they've come up with. Look, you know what, technology, I always say technology is your oyster. You know, there's so many opportunities out there that if you do have a concept, or, you know, because I definitely can see it big in the life skills space as well. You know, and that's a lot of what we're going to be looking at developing as well in the future, around people looking at decisions and consequences, because, you know, with different type of scenario, people don't really see the consequence to behaviours. So there's a real heavy influence on developing technology for people to experience, to actually see what they, an example of what they could be going through, but likely consequence of that behaviour. You know, and the life skill stuff I think is really important. And I would encourage people, if you have ideas, you know, contact one of the digital champions or someone with your concept, or talk to a technology developer, and, you know, and if you can bring it to life, you know, and then you can start to look around, well, how do we have the opportunity to get this funded, or how do we produce it? Because not all technology development is very expensive. I think as the industry grows, the cost will come down significantly, but I'm seeing some amazing stuff being developed for such a minimal cost, but it has such a large reach. So if I can encourage you at all, you know, if you have ideas out there, bring them to life, or talk to people such as myself or Anne who can help in those things as well, about bringing your ideas to life.
And Julianne, just to mention that we do have a VR Forum collaborative group in our collaborative. And so, Rachel, I'd encourage you to drop a line to the team, the project team for the collaborative, and we'll show their email shortly, because they're working on a number of projects, and they've also got a number of developers and researchers in that network who are really interested in new ideas and collaborating on them. One other thing I'd add is that a lot of the work that's being encouraged, I guess, in this segment is really being encouraged to be more open source, so people can co-create and collaborate on the technology without great expense, and then also be able to access developments without having to pay in some cases. So I guess as advocates for greater adoption of technology and access to the digital world, that we also really advocate that it be affordable and accessible by all. So I'd encourage you also to have a look at the group, and certainly the project team is happy to contact you, Rachel, separately and talk about some of those opportunities if you want. I've probably only got one more time for one more question, Julianne, and that's actually from a couple of our members of our expert reference group who have been sitting watching this presentation. And I guess the focus of our community care smart assistive technology collaboration is not really on the technology, rather the new service models, the workforce design, the new jobs that need to facilitate greater uptake of technology, but also the funding and the policy environments in which might stimulate greater uptake. So a couple of the members have commented, do you in fact see the emergence of new jobs in this space? And I guess your own project is seeing that skill sets need to be different, and would you like to comment on that?
Look, honestly, I can see a huge a skills area for development of technology, and we talked about that also when I first was introduced, about really looking how do we redefine skills and training that's suitable for all different type of people for technology development. And I think that the opportunity with technology is in the development phase is you could be working for anyone in the world from your own lounge room or your own bedroom or your office. And that type of opportunity, I think, is fantastic and amazing. So we're actually working at the moment within what we do, especially because we are doing a lot of looking at a lot of development for the future on actually building that training component in on how to develop the technology. So I think this is going to be, and I've been in employment for a long time as well, I think this is going to be a very big employment sector in the short coming future, not in the long coming future, because technology is growing so rapidly that, you know, I always tell people, you know, we need to be at the forefront all the time, in Australia as well, you know, but we need to upskill and train ourselves in order to be at the forefront and to be able to develop these technologies. So I really do believe it is going to be a really big skills area. For us, you know, because this is our first project with employment, it highlights the sort of areas of special need employment and training areas for people, because it is going to such a vast range of people. Well, then how do we take the next step to help people progress into those areas of employment? How do we really look at building the frameworks of what we do to help those things, not just for enVision but for other people as well. We help a lot of other organisations out there as well. So, you know, I really believe that if you're looking from that expert reference group, I would be certainly looking at service model delivery, training model delivery especially as well. Connectivity is going to be a huge factor in that, and that's probably one of the biggest areas of interest for me. Not interest, but also that championing is connectivity, because especially in remote and rural location, if you don't have good connectivity, which they don't at the moment, that really impacts on a lot of what people have the ability to do. So how do we really work towards helping that connectivity base roll out? So I'm pretty heavily involved in that space as well, to make sure that that provides the opportunity, because a lot of rural, you know, if you're working in agriculture, that's good, but there's not a great deal of employment opportunity. So, you know, developing leaders for me is about developing economic development. What can we do to help build economic development so their own communities are self-sustaining themselves? You know, and I really believe that economic development growth is in the technology sector. I hope that answers the question.
That does, Julianne. Thank you for that. And that's we've got a couple more questions on the pane, but that's the only the time that we have available today. So we'll follow up those other questions. Thank you, Julianne. Before we finish today's session, though, I'd like to just give the people in attendance just a view of some of the upcoming events that we've got going. Part of our project, we're lucky to be able to in next week to have a profile in Canada, and we're looking at particularly coming back for our consumer portal research, some leading European and Canadian and American research around living labs. So we're going to share that in an upcoming seminar. At the same time, some of our team are going to join Julianne and her team up in Cairns at the Queensland Disability Conference, and we'll be manning a stall up there for the Queensland Government. So I'd encourage you to go and see Liz and Imogen from the project team who'll be up there, and they'll be showcasing some of the work that we're doing in the collaborative. We're also presenting at the Entrepreneurial Business in Community Care Conference in Brisbane on the 23rd of September. So if you're not registered for that, we'd encourage you to register. And between the 12th and the 16th of September, we'll be travelling through Wide Bay Burnett area, and we've got a number of events being held during those days, some focusing on carer and client issues and various service provider events. And we're also going to be joining with a number of other Queensland community digital champions in Hervey Bay that are coming together as part of Disability Action Week. For everyone, I just remind them that our webinars you can download after the event. It usually is about a couple of days while the team edit the webinars and get them posted. But you must be registered on our site, so we encourage you to go and take the time to register. And we've got a series of other events coming up in September, including living labs, robotics, and some sessions on smart cities. And the team will send you some further information about that shortly. And lastly today, I'd like to acknowledge the efforts that have been put into today's session. We've had some technical issues in the background, so I'd particularly like to thank the Community Care Smart Assistive Technology Collaborative Project team. And today that team's being led by Imogen, and she's been doing the technical work today, so I'd particularly like to thank Imogen for her support today. I mentioned that various members of the project's expert reference group were on board today. They're working solidly in the background. The expert reference group comes from a variety of backgrounds and a variety of disciplines and work settings, and they've really been contributing greatly to the development of the site. I also would like to again acknowledge the Queensland Government for their vision in funding our project, and particularly thank today's presenter, Julianne Lambourne. Julianne, the passion in your work is obvious, and your commitment to getting greater opportunities for people in employment and the workforce is very obvious as well. So thanks for your dedication and thanks for your innovation in the project and detailing it today for our audience.
Thanks, Anne.
Thanks everyone for their participation today. We're having record attendances, so I do thank you for that, and again acknowledge those people who have been to 22 sessions with us. So any other comments or concerns, the team will send an evaluation following this, but please we'd encourage you to email us at sat@communityresourcing.com.au. Thanks everyone.
Thank you.